Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 9, Episode 5 of the Function with Purpose podcast. Thanks for joining in. This is Dr. Amy. If you're new to the channel, welcome. Also, don't forget, friendly reminder, these podcasts are also posted on the Fortress Physical Therapy YouTube channel. So that's another avenue that you can access these podcasts other than your favorite podcast app. Okay, man, I've had a couple of these encounters, maybe about 3, but one in particular, a patient reached out, and she was in severe, acute, like hot, acute, severe pain. So, today's topic: when are meds or medicine appropriate to use during the physical therapy timeline? So I'm going to tell you a little story. I like stories. I think people can relate to stories. And you may know someone. But with this particular patient, education was 100% in the forefront, helping her to mitigate this extreme severe pain. So this patient was through a previous patient of mine, his girlfriend, and we connected, and I got her in for an evaluation, and she's hobbling in. She's limping. And I'm like, hey, okay, tell me what's going on. What's up? She's like, I have shooting pain down my left leg. I've had this in the past, but nothing like this. It straight up hurts. I can't sit. I can't find a comfortable position. The whole leg hurts. My back hurts. I've been to some other healthcare providers, literally my whole life in particular, and tried to seek out their help here locally, and the guy said I had piriformis syndrome. So I kind of just crossed my arms and put my head down in my hand, and I was like, okay, number 1, things are acute. You know that, obviously. Number 2, this is what's going to happen. We will do a quick assessment, but our goal today is to try to calm your symptoms in your leg. See if we can move the symptoms from the foot/calf up towards the thigh, up towards the butt, maybe in the back today. I don't know, right? Right here, right now, this is not piriformis syndrome. I'll tell you that right now. So I was stern with her, and she was like, oh yeah, I totally believe this is not piriformis syndrome. Side note, that is just a generic term, meaning I don't know what the F I'm talking about. Okay, that's for another episode. Oh, I'm going to get heated on this. Anywho, so as I'm treating this patient, we're finding a position that can ease her leg symptoms as best as we can. So we get her in the sideline position, and her hips are kind of shifted a little bit more towards the ceiling, because I have a table that can elevate up at specific areas, and we were able to ease the symptom from her foot and calf and put it into her thigh. I'm like, great, cool, found a position. So as I'm assessing her and all of that fun spiel, I said, hey, listen, this is what needs to happen. You need to contact your primary care, or if at all, you go to urgent care tonight, right after this, and you get some medicine that will help mitigate this pain. She's like, yes, done. So I explained the process. Because medicine is going to be totally appropriate right now in order to help her function. Medicine, oral medication to help with pain is okay at this moment when you start physical therapy. At this moment in time of the physical therapy timeline. Because we have to calm it down. It is intense. It is hot right now. She can't move. She can't sleep. She can't even work. She works from home. She has to be able to sit, stand, work at the computer, cook, clean, use the bathroom, sleep, lay on her side. She can't do any of that. So this is totally appropriate where medicine takes a number one priority. So she did that exactly. So before she left, I'm still explaining, okay, medicine will help do this, that, and the other. And she's like, yes, got it. Totally understand. In the meantime, this is what you're going to do for physical therapy home exercise program. You're going to get in the sideline position as you are right now. That's all. 5 minutes a day, maybe up to 10, in 3-minute bouts. 3 in the morning, 3 in the afternoon, 3 in the evening. Because our goal is to try to move these symptoms from your leg and put it to where it's probably coming from. I told her, I already knew off the bat. I'm like, I think it's L5, S1 area because she's experiencing pain, the shooting pain into her foot. And if you're a physical therapist listening to this or a healthcare provider, you got to know your anatomy, right? So it all makes sense what she was describing. I'm like, okay, this is something that is disc related. Something in her spine is pressing on her nerve and it's causing symptoms down her leg. In the meantime, we have to get on some medicine to help ease the symptoms, right? And physical therapists are unable to prescribe medication. It has to come from a licensed practiced physician, i.e., medical doctor, doctor of osteopathy, nurse practitioner, physician's assistant. Those individuals, and even clinical psychologists, those individuals can prescribe medicine, oral medicine. So before she even left, I said, hey, listen, you came in for physical therapy today. Don't expect things to get better within 24 hours. It could get worse and then get better. She's like, okay, got it. So there was a lot of education on this session where medicine needs to be a part of her healing process in order to get her to function, right? So that was her eval. So then I see her the next week, or I think I was on vacation. So, we stayed in communication via text message. And then at her second follow-up, i.e., which would be her hypothetically first treatment session, all right, give me some updates. She's walking in. In fact, she drove by herself to that session. I'm like, oh, hot dang, this is good. You drove here. She's like, yep. And I can sit a little bit better. I drove the car. I felt confident. I didn't feel like I was unsafe. My boyfriend clearly didn't have to come with me during this session. Things are pretty good right now. So I'm like, okay, great. Are you still on the medicine? Actually, I was on a dose pack, and literally after finishing that last dose the next day, it kind of, a little bit started wearing off. And I think I overdid it. We did a lot of walking. I might have done like 5 miles. And then Sunday, I was down for the count. I was like, oh. So she's like, I'm still feeling the symptoms into my leg, but it's not as intense. I'm like, okay, this is good. All right, well, I still think, obviously, there's some inflammation or a chemical component to this. So medicine still needs to be a part of your healing process. She's like, oh, okay, yeah. I'm like, you might have to go back to urgent care, or like literally you need to set up an appointment with your physician this week as soon as you leave. Okay, cool. So still a lot of education. We were able to progress her movements with therapy. We were able to get her on her belly, kind of lay flat, and we were able to mitigate the symptoms or centralize it from the calf area to literally the left side of the hip and a little bit into the back. And I'm like, yes, this is great. She's able to get on her belly. All right, what's your job after this? She's like, okay, I'm going to call my primary care. If I can't get in ASAP within the next 2 days, I'm going to urgent care and seeing if I can get another dose of prednisone, whatever they put her on, for acute pain. I'm like, okay, great. This is awesome. So, I can get super deep into this scenario, but I'm going to kind of stop myself from there. So, there are, I guess the moral of my story, or the moral of when are meds appropriate during the physical therapy timeline. I think in this case, when someone is obviously unable to fulfill their tasks as a citizen, as a person in their environment, in their daily environment, in their work environment. They can't sit, they can't stand, they can't move, they can't sleep, they can't cook, they can't clean, it's hard to wash themselves, etc. It's hard to use the bathroom. You have to be able to recognize this from the healthcare perspective, that this is something that probably needs some attention from an actual physician along with physical therapy. Of course, I'm going to bias my profession. We spend a lot of time with our patients. We actually assess patients. We assess the person in front of us. So, just my little rant. When this patient first came in for her evaluation and she told me seeing a specific healthcare professional, and that professional, I wouldn't even call them professional, was like, yeah, it's piriformis syndrome. You are poo-pooing the whole healthcare, allied healthcare profession in general. You do not know what you're doing. Okay? Anywho, that's a whole nother topic. But in this prime example, medicine, oral medicine, seeking out a physician's help along with going through physical therapy is appropriate. Okay? When someone is in this significant amount of pain, strain, in this case, this patient, classic lumbar radiculopathy, or if you want to call it disc herniation, whatever it is, it's pissing off her nerve, causing symptoms down the leg. We need to unpiss it. And medication will help with that. So, from an acute perspective, when someone comes in to physical therapy and they kind of present something like that, where it's hard to get them in a specific position and they're telling me their symptoms, they're telling me how their daily routine is, oh yeah, you bet your booty that you're going to get talking to in a good way from me that, okay, I think we need to get your physician on board with this, and we might need some medicine on top of continuing physical therapy. So hopefully that gives you some perspective, especially in this specific scenario, that medicine is okay during this portion of the physical therapy timeline. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.